Okay, now we will discuss about listening part A. So the first thing first, when you only have 30 seconds, the main thing, you only have 30 seconds to read 1 to 12 blanks. Okay, so how you can properly use these 30 seconds? Before starting the 30 seconds, you have to read this introduction. Don't forget to read the introduction. So now you are going to hear a physiotherapist, so we know that what the physiotherapist work. Okay, and the patient name is J Ray Sons. Okay, so that you only have 30 seconds, and the main thing, 90% of the answers come from patient. This thing that we need to understand, 90% of the answers comes from patient. What it mean? Because when you are listening something, when you are listening this audio, so most of the answers in that blanks comes from patient, not from physiotherapist, not from doctor, not from any nurses. So you have to focus on the patient. You have to focus on the what patient is saying. Less focus on the what other person is saying, more focus on the what patient is saying. It does not mean you don't have to listen the physiotherapist, you don't have to listen the doctor. Yes, you have to listen the physiotherapist and doctor as well, but your more focus should be on the patient. Okay, just wait a second. I will erase. Now I want to give you some other details. Okay, and the next thing, don't forget to read these highlighted text. Okay, this will guide you throughout your listening. Throughout your listening, this sentence will guide you, like when they said, when they turn from this to this, they will say something about symptoms. Now we will going to discuss about symptoms, and maybe physiotherapist can say, okay, now we have to turn on your signs. And okay, so instead of symptoms, the physiotherapist can say sign. Instead of symptoms, the physiotherapist can say something visible symptoms. They don't use the same words, they use vocab, so you need to improve your vocab as well. Okay, so and the next thing, the most important thing in the listening is that, what is the most important thing in the listening? Now we will discuss about the answers. 90% of the answers comes from patient. Don't forget to read these highlighted texts. They will not say this as the same as this is like patient is description of symptoms. They will say something, but the meaning is the same. Okay, the occupation, they will guide you during your listening. So pay attention on these as well. Okay, these things, these highlighted text. And the next important thing is what technique that you should use to get your most of the questions correct in reading part A. Okay, the technique is anticipation. Anticipation. What is the meaning of anticipate? Anticipate, we can also call it anticipate, anticipation, anything. What is the simple meaning of anticipation? Is prediction. Okay, means you have to predict what in this blanks. You don't have to predict the answer itself, you have to predict the category of the answer. Like for example, back injury sustained lifting. You don't have to predict lifting any box, lifting any table, lifting any chair. Just predict maybe in this in these all things like reading the blanks and um, anticipation. Reading the blanks and anticipation you have to do within these 30 seconds. This is the challenge. This is the challenge. This is the main challenge in your listening exam. You have to you have to anticipate the answers, you have to anticipate the category of the answers, and you have to read all the blanks within these 30 seconds. How you can do that? How you can do that? With practice. The only way to do it is practice. Okay, so don't be fear of practice. The practice is your key to pass this exam. So anticipation. Don't anticipate or predict the answer itself. Predict the category of the answer. What this means? Sorry for my spelling, I know, because so the main thing is that I just want to let you know the main thing. For example, back injury sustained lifting, you don't have to predict the answer itself. Box, table, chair, you don't have to predict the answer itself because you don't know the answer, but you know the category of the answer. Means lifting something. What that mean? Back injury sustained means patient when the patient lifting something, that means in that situation when the patient lifting some hard things, some very hard things, some big things, some small things, then his back start hurting. That's it. Okay, so in that situation we can say that the answer is a object. The answer is a object, means any table, any chair, anything. Okay, so in the second thing, so symptoms. Pain located in, you don't have to predict the pain located in arm, the the pain located in back, located in legs, arms, chest, anything. Just understand pain located in means in that blanks the answer will be like any body part. You have to predict only this, any body part. The answer in that blanks is any a body part. Okay, you don't have to predict any body part itself. Just remember this. In but during your listening you only have to focus on this body part. Pain described as, I can say that pain described as any sensation. Okay, any numb pain, any sharp pain, anything. Okay, so you have to predict these things, like, so this help you to get your answer as soon as you can. Okay, so this is the pain vocab. Numbness, sharp pain, numb pain. This is the pain vocab, so you also have to know these things. Okay, numb pain. So mention inability to do something. I can see that they in this blanks mention inability to do something. You don't have to predict, like mention inability to walking, talking, running. Don't predict the same answer. Just predict the category of the answer, means mention inability to do something. Okay, so that you will get your answer easily. Dash sensation, we can number sensation, tingling sensation, these things. Occupation, we know that if you will not read the occupation, so how you will get the answer, how you will get the correct answer. So when they say something about occupations, you have to understand that here is some occupation like employing some anything their work related, anything. Okay, initial treatment, he took NSAIDs, application of any ice packs, anything. Okay, so referral briefly, further treatment, epidural injection. I can say that after reading this further treatment, I can see that in that situation some treatment name in that answer. So that's just predicted. Decide not to try to do something same thing. Patient attributes recovery to previous diagnosis, sciatica, probably later to any category. Okay, so you have to predict the category. I want to um, reassure you something, like the only two things that you need to remember, most important, 90% of the answers come from the patient. It does not mean you don't have to listen the physiotherapist or doctor. You have to listen, okay, but 90% of the answers comes from patient. Don't forget to read these highlighted words. Okay, highlighted words. And the second thing is anticipation. Anticipate the answer. Don't anticipate the answer itself, anticipate the category of the answer. Okay, so the main thing is that the challenging thing, I can't say this is a hard thing. The challenging thing, you have only 30 seconds to do all things: prediction and understanding. Okay, so take care for now.